Hello everyone, I am Sneha, lecturer, Department of Physician Assistant, SNS College of Allied Science. Today we are going to see about class on antiarrhythmic drugs. What is arrhythmia? Arrhythmia is a irregular heart rhythm. Antiarrhythmic drugs are used to treat and manage irregular heart rhythms known as arrhythmias. These medications act on electrical signaling pathways of heart to restore the normal rhythm. Classification: there are 4 classes present in these drugs. First one is sodium channel blockers, example quinidine, procainamide, lidocaine. These type of drugs act on phase 0 depolarization. Next is class 2 beta blockers, example propranolol and metoprolol, act on phase 2 and 4. In class 3 potassium channel blockers, example amiodarone sotalol, act on phase 3 and prolonged repolarization. In class 4 calcium channel blockers, verapamil and diltiazem, it act on phase 2. So 4 types of drugs act on various phases. Here is the image of 4 types of drugs act on various phases. Class 1 sodium channel blocker, class 2 beta blocker, class 3 potassium channel blocker, class 4 calcium channel blockers. Dosage and route: quinidine, orally we will give 200 to 400 mg every 6 to 8 hours, intravenously 100 to 200 mg every 6 to 8 hours. Next is propranolol, orally we will give 10 to 30 mg every 6 to 8 hours, intravenous 1 to 3 mg every 5 minutes. Next is sotalol, orally we will give 80 to 160 mg every 12 hours. Next is verapamil, orally 80 to 120 mg every 8 to 12 hours, intravenously 5 to 10 mg over 2 to 3 minutes. Mechanism of action: the class 1 sodium channel blockers, blocking the sodium channels to reducing the heart excitability, because sodium channels induce the heart excitation. So by blocking these sodium channels, sodium ions will not enter into the heart cell, so it will reduce the heart excitability. Next is class 2, block beta adrenergic receptors, reducing heart rate and contractility. Beta adrenergic receptors regulating the heart rate and also heart contraction. Usually it will increase the heart rate and heart contraction. By blocking beta adrenergic receptors to bind the we will reduce the heart rate and contractility. Next is class 3, block potassium channels, prolonging the heart axon potential, because potassium ions helps the heart axon potential generation. By blocking this potassium channels and potassium ions, we will prolong the heart axon potential. In class 4, blocking calcium channels, reducing the heart contractility. By blocking the calcium channels, we are preventing the calcium ions entering into the heart muscle cell, so it will lead to less heart muscle contraction. So pharmacodynamics, there are 3 major effects: reducing the heart rate, increasing the heart refractory period such as resting period, and also stabilizing the heart rhythm into normal. Pharmacokinetics: absorption, oral bioavailability ranges from 20 to 100%. Distribution, volume of distribution ranges 1 to 5 liters per kg. Hepatic metabolism will occur, and excretion is renal excretion. By kidney, the waste materials will be excreted. Next is indications. There are 4 indications. The first one is atrial fibrillation, the next one is atrial flutter, third one is ventricular tachycardia, and also ventricular fibrillation. These 4 conditions will increase or decrease the heart rate and also leading to abnormal heart rhythm. So by giving antiarrhythmic drugs, these 4 conditions will cure. Next is contraindication. We should not give antiarrhythmic drugs to heart block, cardiogenic shock, because it will lead to severe conditions. So we will prevent these type of drugs to give to heart block and cardiogenic shock. The third one is severe hypotension, because in class 2 beta blockers will reduce the blood pressure also. So for a hypertension patient, we will not provide these kind of drugs. It will lead to severe hypertension. The fourth one is pregnancy and lactation. It will affect the both mother and fetus also. Next is adverse effects. There are 2 types of adverse effects present: cardiac effects and non-cardiac effects. In cardiac effects, these type of drugs will worsen the arrhythmias and also heart block, cardiogenic shock. So we should not give heart block and cardiogenic shock patients to antiarrhythmic drugs. Next is non-cardiac effects such as nausea, vomiting, diarrhea, headache and dizziness. By giving beta blockers, it will reduce the blood pressure, so it will lead to lower the blood supply to the brain, so it will lead to headache and dizziness. Nausea, vomiting, diarrhea will occur because these type of drugs will irritate the gastrointestinal system, so it will lead to nausea, vomiting and diarrhea. These are all the adverse effects of antiarrhythmic drugs. As a physician assistant role, we should monitor the patient heart rhythm and cardiac function while giving these type of drugs, and we should educate the patient about medication side effects and interaction, and also monitor for adverse effects and reporting them to the physician. Thank you.